This session is entitled The Language of Pain. In order to understand pain assessment, it's important to understand the factors that affect how people communicate about pain. In this session, we will describe the difference between pain perception and pain expression, and discuss some of the biological, psychological, and social factors that affect pain expression. Most often we feel pain as a result of an injury, so we often make the assumption that injury and pain are directly or causally linked. Since pain usually follows an injury, we assume that when there is pain, there must also be an injury that explains the amount of pain, and that the two should be directly proportional. If there's a lot of pain, we assume that there should be a lot of tissue damage, but if there isn't pain, that there must not be any tissue damage. There are many examples in everyday life that challenge this assumption. It's important to keep in mind that the amount of tissue damage someone has is only one of many factors that determine how much pain they will feel, and we often see mismatches between how much pain someone reports or displays and what we expect to see based on the clinical assessment. There are several reasons why there might be a mismatch between tissue damage and pain. In Session 2, you learned about the ability of the nervous system to modulate nociception and alter the feeling or experience of pain. It's also important to remember that how much pain we express depends on several factors other than how much pain we feel. This will be the topic of this presentation. To understand this, it's important to recognize that pain perception, or the ability to feel pain, is different from pain expression, or the ability to report or behave in a way that communicates the feeling of pain. The role of pain perception is geared towards identification of harmful situations. It is a noxious, unpleasant experience that demands our attention so that we can first mobilize our systems to escape from any potential harmful situations, second, to limit further damage by guarding and protecting the painful area, and finally, to seek recovery, healing, and relief. Pain expression, on the other hand, has a different purpose. The function of pain expression is to solicit comfort from a caregiver and to warn people around us that what happened was harmful. Like any social communication, pain expression is strongly influenced by the social context and the thoughts and emotions of the individual. If the person feeling pain perceives others around them to be supportive, they will be free to express pain. But if they perceive others around them to be threatening or not helpful, they may suppress pain expression. These behaviors are generally unconscious and depend on learned behaviors acquired over years of experiences. The physical cost of pain behaviors is another factor that affects the intensity and duration of pain expression. When pain is persistent, or when the individual in pain is fatigued, he or she will protect these physical reserves by only intermittently expressing pain. This explains why an older adult who may have continuous pain only grimaces or moans when he or she is moved. It is important to remember that when we measure pain, either by asking someone to self-report or by observing behaviors, we are actually measuring pain expression. There is no direct way to measure how much pain someone is feeling, so we have to rely on assessing pain expression while trying to understand the many factors that might be an influence. There are 3 steps we recommend to screen for pain. First, inquire about whether or not pain is present. Second, assess the intensity or other dimensions of pain. And third, document your findings so that you can communicate with others on the team what you found. To inquire as to whether or not someone has pain, it is important to use a word that is meaningful to that person. Older adults may use words like hurt, uncomfortable, ache, or sore, rather than the word pain. Watch how this nurse tries different words to inquire about pain.
Good morning, Jerry.
Hi.
Are you having any pain this morning?
Pain? No, not really, no.
How about discomfort?
No, I don't think so.
How about aching?
My knees ache, especially at night, hard, and sometimes this elbow. Can't straighten it.
By inquiring using several different words, the nurse demonstrated interest to the client about pain. The nurse also found that the client used the word aching, but not pain, to define the feeling of discomfort. Be sure to give the older adult enough time to respond to each question. Once you identify the word that is used to refer to pain, document it so other staff can use the same language when inquiring about pain later. To summarize, pain perception and pain expression are different. Both pain perception and pain expression are influenced by biological, psychological, and social factors. For this reason, we commonly encounter mismatches between the expected and reported amount of pain. People use different words to identify pain, so it is important to discover what wording to use to assess pain in the older adult.